Thank you. So I'm Jaspal. I'm from Samaritans. Samaritans, you're probably all aware of. We're best known for our emotional support service. Increasingly, over the last few years, we've been doing more and more work with employers and working in the crisis prevention space. And over the last year, we've been working on a project in the retail space. As a bit of a framing device, so this isn't too abstract and you know what we're talking about, we're just going to play a short video which shows the tool that we have been working on with a bunch of retail partners for retail staff. You'll hear from some from the panel to talk about it in more detail. But this is a wellbeing tool which encourages emotional resilience, self-awareness, and peer support for people working in the retail space. It's interactive, it has video content, it's been designed specifically with the retail space in mind. The real story is about how the sector came together to collaborate on this and develop it. So we're going to move into a panel discussion shortly, but I might just ask my colleagues to introduce themselves first.
Hi, I'm Paul. I'm Health and Wellbeing Manager at the Co-op. I've got a small team of people that lead on wellbeing for our 63,000 colleagues across 4,500 locations.
Hello, my name is Yulia, and I'm Head of Wellbeing, Diversity and Inclusion at Journalists Partnership, looking after 83,000 colleagues. And I'm not going to compete on numbers with Tesco, but we are a large employer as well.
Hi, I'm Beth Rochford. Sorry, I did recently change my name through your marriage. I knew I was going to do that. I'm Beth Rochford, and I'm the Wellbeing Manager at Marks & Spencer. 81,000 colleagues across distribution, stores and offices, so a real diverse workforce and on a large scale.
Hi everyone, I'm Toni, McKay, and I'm the Head of Health, Wellbeing and Colleague Experience at Tesco. And we have over 300,000 colleagues in the UK and 450,000 globally.
Great. And guys, please do remember to use Slido for any questions you've got. I'll kick us off with a few that I have. So, Yulia, perhaps you can kick things off by telling everybody how this group came together.
Sure, thank you, Jason. Well, as you just learned, we are very big employers, and all the retailers employ a lot of people. So mental health and well-being is very important for our board agenda. So much so that, inspired by the work that was done for the city, Wellbeing in the City tool that was developed in conjunction with Samaritans, our chairman, Charlie Mayfield, reached out to his peers in the industry and asked whether there is an appetite to develop similar tool for retail specifically. And here we are. So we started this work a year ago. We didn't know how it will go. And what the uptake will be. But we realized that what we need in our context is something that is peer-to-peer support. And as Jason mentioned, it's one of the issues that tool addresses, because due to the shift patterns and rotas, what we have is that the line manager has very limited visibility of the colleagues, and the peer-to-peer support is so important. And to address the issues of mental health, we need to put a lot more focus on prevention and elevate everyone's understanding of mental health.
Thank you. And Toni, perhaps you can talk a little bit about what brought mental health specifically onto the agenda for Tesco's and why you wanted to get involved in this project.
Yeah, absolutely. So mental health is absolutely a huge priority for Tesco. And I think being the UK's largest private sector employer, we know we have a huge responsibility, not only for our own colleagues, but actually also to take a lead in championing good mental health. So when this opportunity came up, we felt it was really important to collaborate and work with our competitors, because health isn't something that we want to compete on for our colleagues. So when it came up and we had this opportunity to look at what are the common barriers that we face around mental health within retail, it was just a no-brainer for us to work together. And some of those common challenges in retail are very different to other industries, because it's such a diverse population. You've got the distribution centres, you've got the stores where you're on the floor, you've got the offices. And I'd also say retail is such a fast-paced environment that can come with its own problems. So being able to work together, share knowledge, resources, and work with the Samaritans to create a fantastic tool to look at that, it was brilliant.
Great.
I would agree with what you said, Toni, but beyond that, retail is the toughest of environments. Low margins, very little room for investment. Colleagues are in retail facing crime on a day-to-day basis. We frankly cannot afford to train everybody face to face. We haven't got the luxury of millions of pounds to invest. And so the opportunity to collaborate, to come together, to invest a little, to have massive impact was a no-brainer. We're co-op, we cooperate, it's what we do. And so when John Lewis approached us with the idea of let's do something together, we jumped at the chance, as did the others.
And I think one of the things we tried to focus on when we did come together and share what our colleagues were facing and what the priority was is, we've heard a lot today, which is so important, is about kind of reactionary support and having, good line manager capability and having the right actual kind of clinical mental health support to get your people to. But a huge part of the puzzle is self-help and just self-awareness and understanding. And obviously it was quite a fast is this a bit of an experiment? Can we all get together and actually produce something that's worthwhile for our people? But keeping at the heart of it that it needed to be something that was spoke to them, was easy just to kind of be like, oh, that's quite interesting, and all the Samaritans, and we've come together, and actually get people sort of listening. And we all know how hard it is to come up with something new that kind of engages people in this space. But once hooked in, really simple, basic understanding of practical stuff that you can go and do yourself, think about yourself, and as you'll see on the tool, being able to kind of practice some of the conversations with colleagues and things that actually were really tangible, that, it doesn't matter if you have done a workshop as a line manager once every, 5 years. This is the stuff that you need at the point that you've had a look at it, and then you go and practice it in conversation. So I think that was quite powerful and something that we wanted within our offer for our people.
Great. And we've touched upon some of the content there, but perhaps if we take it back a step, Toni, could you perhaps tell the group what the aims were at the start and what we were trying to achieve?
Yeah, so the overall aim was to create a tool that could support the 2.9 million workers that work within the retail around mental health. So we knew it was going to be important for it to be practical, simple, credible, suitable for everybody, no matter what work level you are, but also being able to be used however and whenever a worker would need it. We knew that another aim would be that we can increase the conversations happening within the workplace and actually encouraging those mental health conversations to take place and having those difficult conversations. So I'd say they were some of the key aims, but I think one of the hopes we definitely hoped to achieve was not only breaking down stigma in the workplace, but also encouraging others to come and collaborate to look at mental health, because the more of us that work on mental health, the bigger impact we're going to be able to have on society. So I think there was quite a few aims, but I'd say they were the key ones that we had.
Yeah, and I think from Samaritans' perspective, I mentioned at the start how our work has moved away, in order to support the work we do around the helpline, to do more in the employment environment. That's still very much with Samaritans' DNA at its heart. So promoting active listening, promoting human connection and emotional support, and promoting the idea that we can create a nation of listeners, and that can exist in the employment environment. Was what brought us to the table and made us so interested to participate. But going back to the industry, Yulia, what do you think is the significance or the importance of an industry working together in this way to collaborate something for its shared workforce?
As Toni mentioned, we are the biggest private sector employer in the country, but also we're quite diverse in terms of types of companies. So we have lots of small and medium enterprises that may not afford some of the tools that large employers might afford. So what we wanted to do is to create a tool that would help everybody in retail, but also support Samaritans as well, because the words of Ruth about creating the nation of listeners out of UK definitely resonated with us, because our people, if you work on the shop, so on the coalface, so to speak, in terms of the challenges that you face, and your patience would be tested several times, because also customers are not becoming more patient, they're becoming less, because they expect a lot more. And you have to have a lot of personal resilience to deal with this. And what we wanted to support our colleagues with is a tool that would help them recognize some of the signs and look after their mental health, but also have an understanding and opportunity to reach out to their colleagues, because through our research we found that about 50% of people didn't know how to approach somebody who they see as struggling, and because they didn't want to make things worse. But it's just boosting this confidence and allowing people to have an opportunity to offer this listening ear. It would help to not to reach to the point when somebody needs reactive support. It's something that you can address proactively. And it's on a human level. It all starts with a conversation. You don't have to have pills for everything. It's just if you connect and you have a good conversation, that's, we see it as a great step towards better prevention.
And we're all facing the same challenge. You know, we're in many, many, many locations. It's really hard for us to get messages out. Communication is tough. Being able to put everything mental health in one place for all of our people was valuable and is valuable. You know, each of us have got the tool in a place that all of our colleagues can access, whether that be at home, whether that be at work. And we've all got a personalised version that has signposting in for the things that we have that are specific to our organisations. So, you know, we're not going to crack the communication issue overnight, but this is a start. This is about being accessible and accessible to everybody.
And just on that, I think it's important to talk a little bit about the success of the tool. So we launched this in the middle of October. So it's only been live in the employment businesses for the last couple of months, but we've already seen over 5,000 individuals access the tool. And knowing that we've used NHS, Public Health England, Samaritans, evidence-based approach to developing the products, resources that sit within it, it's really about cut through, because we know the content is of the right quality and of the right robustness. The cut through was really the most important thing. So having those deployment plans that exist in the businesses has been really important. Beth, what recommendations would you give for other industries that are interested in coming together to try and approach this problem?
Definitely. I mean, I think the biggest thing here is that it isn't about necessarily budget. It is about aligning yourself to experts, as not all of us find ourselves in these roles being experts in mental health. I think one of the things we learned with all of the initial feedback and actual surveys, data-driven surveys that we pulled together as part of the project to enable designing this tool how our people actually wanted it, I think the first recommendation would be is that, you know, we need to treat our colleagues in the same way that we treat our customers. And it doesn't matter what budgets you have or resources or sign-off. If you're asking those people what they need, what they're missing, what they're vulnerable around, and that's everyone in the organisation. So we shared surveys across all of our organisations to be able to get that data. So people that might be dealing with ongoing mental ill health problems, or people that are under pressure or stress at work, and just making sure that actually collectively that qualitative feedback is leading the way for your solutions and what you're designing, because it's really important to bring that together with all of your absence metrics and all of your data, but it's actually looking for that gap. And actually, once we got together as organisations, we had very similar themes of gaps that we weren't quite getting through to, and that could be because we're retailers and we've got these specific types of challenges, and whether it's sector specific, like with the city, once you get together you realise you've got quite similar challenges, and being able to then say, right, well, what can we do effectively to break down some of those challenges? And then I think the other thing is there is just that safety in numbers. I mean, often when you do these kinds of roles, you have a world on your shoulders of how much you think you should be trying to do, and there's such a vast space out there. And actually sometimes not just having good networks of people in this space, but actually working alongside those people is something that I hadn't done before. So I've worked with other competitive businesses on different types of projects, but rather than just going to a conference and saying, oh, what are you doing on this, or what are you doing on that, but actually working on a common good, it's not hard to do, and you shouldn't have to wait for someone to come along and invite you to do that. So yeah, those would be my recommendations.
Great, good. So Yulia, now that this group's been formed and it's come together, what do you see as being next in terms of collaboration or future work that this group of retailers can do on this topic?
We started to learn about what others are doing and kind of jumping on wagon, so to speak. So, for example, sleep is quite a big issue for night shift workers. So we've partnered with Wellcome Trust and developed a tool called Liminal Space Nightclub. So Co-op was there first, but then Paul very kindly shared with us some of the learning. So it's what I see is developing is we all, as Beth said, we have some things that we do better than others, but in this particular space, we don't view it as a competitive thing. It's more about how do we elevate the mental health for the whole nation, well, for nation of shoppers and nation of retailers. And given that our industry is going through such a tremendous transformation, it's more important than ever that we collaborate as opposed to not.
Great, thank you. I'm going to start moving to questions from the floor. How do people who don't work at a computer access the online tool? Toni, I might ask you to tackle that one, given you've got experience of both working in the pure retail environment and also looking at it from a wellbeing perspective.
Yeah, absolutely. So it's not that long ago that I was actually a store manager in Tesco. And it is a huge thing that we have to go through around communicating. How do you get down to those shop floor colleagues, the 7-hour checkout person, etc.? And I think the key is through the managers. So once you get the store management population engaged, they get their other managers engaged. I think that is the biggest way you can get the colleagues engaged. What I also found that when we were engaging our colleagues, it'd be doing it live. So, for instance, like you did up there, doing a display, getting it up. That's how we'd do it in a store. So we'd call it a team 5. We'd grab as many colleagues as we could, we'd talk through it, and we'd get them talking about it. Something we did with the launch of this was something a little bit different. We also did little leaflets that they could take away, and we felt that went down really, really well. Instead of just a poster that we get called wallpaper now, actually, in Tesco, it went down really well because they felt they could take it away, they could understand it, and then ask more questions. But it is a huge thing that we go through around how do you communicate to every colleague. Definitely.
I think one of the things you've got today, even the kind of classic demographic in M&S where you think, oh, they might not even have a smartphone or download an app. Like, people will download something if they think it's of benefit to them. We're all interested in this topic and we all deal with issues around this topic. So I think that is probably one of the things that we do have on our side is actually if you can find some sort of digital solution or a way into a system, even if it's an M&S system, but you can get on it from home, people will be happy to look at that in their own time. They won't see that as, oh, you're giving me training to do, or should I be being paid for this? A lot of our colleagues are now going on to kind of put in their shift patterns and, availability, etc. We need to keep it separate so it feels like a benefit. But I'd say, we're in a space where people want to look at this stuff outside of the shop floor. So even if they can't get at it when they're on the till, you've got to drive that need for it.
I think as well, when you are talking to the colleagues about it, if you let them understand what the benefit is for them and how they can use it, I think it makes a huge difference. It's bringing it down to real simple terms and what can they get from it. I think sometimes that where messages can get lost within retail, definitely.
Great, thank you. So there's a question about what else the businesses have had to put in place around mental health to support the tool. Yulia, I know John Lewis and Waitrose have done a lot of work in this space. Perhaps you could share some of your knowledge and some of the stuff that you guys have done?
No, happy to. I think the way we thought about this tool, it's almost like part of an ecosystem rather than the solution to everything. And so we partner with Unmind, who's one of the presenters here. So we provide this solution to all our we'll call them partners, but the industry term is colleagues. We also do training for line managers on mental health. We have in-house emotional support. So we have quite a lot that's already happening. And actually, we introduced occupational health in 1929. So it was almost 20 years before NHS was established. So it's something that John Lewis Partnership has been investing for a while. We just thought that it's almost a great opportunity to leverage technology to teach people human skills, which I know it sounds a bit ironic, but it's almost like using some of these technological solutions because everybody has a smartphone pretty much. And all our colleagues, they keep in touch through the smartphone and they wouldn't mind downloading something that they find useful. Because even the toughest audience we have is our delivery drivers. Absolutely toughest audience, but they requesting some of these tools to be installed on their work devices because that's how they communicate with each other. for me, if they describe something not bad, it's just like glowing praise from anyone else. Because, you know, they're nice individuals, but that's their cultural references is very different. So it's almost like finding ways for people to engage with it, but it's almost like we're not trying to make them resilient and then throw lots of stuff at them. It's more of we want to support our colleagues to weather the challenges we're all going through as companies.
And the way you describe it as an ecosystem is quite nice, and it's ever evolving. So, you know, at the Caudwell, we're using our data to think about what next. The journey will never stop. So, you know, the tool is basic mental health, a bit around building your personal resilience. We go on from there. We've done some work around supporting absence and return to work conversations, and it will naturally go on from there. I know the next thing on my list is self-harm, a big topic, but something that we're seeing coming out in our data, and therefore something that it's important for us to tackle.
Great. And I know in terms of getting the word out about some of this stuff, we do rely a lot on using web-based promotion, so social media, emailing, all that stuff. I think what we found at Samaritans is really, really useful is actually going in and visiting businesses and doing lunchtime sessions with, you know, something that's a bit more lo-fi, using some kind of, you know, discussion cards and creating, because while this is a digital tool, it's promoting human connection and conversations. So it should live in that world beyond the tool. It's about changing the culture and using this as a vehicle, I suppose, for want of a better phrase, to do that. Did any of you find get any internal resistance or pushback around either supporting this financially or working with your competitors, so to speak?
I think we've seen quite a lot of examples in the past where actually we've needed to just roll up our sleeves and go, actually, there's a big issue out there and it's affecting us, our business, it's affecting us as retail, you know, with that sort of youth unemployment or health spectrum. I think with all of us, though, it's about taking it back into our organisation and working out actually what is the sell-in, so how does this work for us? So the bit about it being actually quite altruistic, that actually this is then available for other businesses, it can actually really benefit your communities, because once you have got that kind of learning or you're more comfortable talking about it, the impact it has on your families, etc. Some of those things really play into some of our Plan A, our sort of CSR programme credentials. So I think for all of us, and can't speak for everyone, but for me it was absolutely, why wouldn't we do this? This is a big issue for us in our business, and surely we'd want to hear what everyone else is doing and work together, but you still need to find a way to make it work, I think, in your organisation.
You're absolutely right. At the time that Yulia approached us, we'd just been told that we had about a year to be ready for the launch of our mental health community campaign and a charity partnership with Mind. And the message was very much, get your house in order. We cannot launch a community initiative and face criticism from colleagues that are not supported, I don't feel supported. So there was a race to get things in order, get things ready, and this was one part of that solution, of being able to say that we've got a package of things there that show that we really do care.
And I think similarly from Tesco, we definitely felt there's a need to collaborate, because we know a lot of the common challenges and the barriers. I think one of the key ones from us, from talking to colleagues and getting on the ground, was actually there's a massive myth that they feel they've got to be these mental health experts, but something this tool absolutely does great is it makes them understand they don't have to be an expert to have a conversation, but how important it is to actively listen. And this is definitely was one of the gaps in our market, definitely.
It's quite a cool concept, really, because ultimately it puts pressure on you to deliver when you've got to keep up with the Joneses. And absolutely our focus day to day should be, how are we actually helping our colleagues? Like, I don't go to bed at night thinking, oh, you know, how do we look as a brand that we're doing X, Y, and Z? I can talk to somebody about that at work, but I'll be affected if I speak to somebody who actually knew how to get in touch with our employee support program when they needed it, or could recommend somebody in a situation, or had a really great team session where they really geared up their team due to some of the services and support that we had to get through a difficult time in the business. But ultimately, I think, you know, it's great that we put pressure on each other to be setting the bar, and that's great that we can work together to do that. But I think we need a little bit of that competitive streak in this sphere, particularly with the kind of current climate of what's available from a support sector. We don't have big budgets to put into this, but what we do have, we need to be really smart with it to make sure it impacts our people properly.
Great. I think from Samaritans' perspective, a lot of the content in a product like this can be repurposed, reused in lots of different settings, because it's universally recognised, it's evidence-led, and the tools work. What we found has been one of the biggest challenges is just really understanding what different environments look like. So understanding what are the barriers to learning, the barriers to access in a retail setting, because they could be very, very different to the construction world. They will be very different to potentially a professional services environment, or as you know, the military where we've begun doing some work. So while the messages remain the same, I think understanding the learning styles, the personas, and actually what's stopping people accessing this stuff, whether it's culture, physical access, and providing something that can be deployed in lots of different ways has been really, really important. Great. There's a question at the bottom which I can't quite read because the clock's in the way.
The clock's actually wrong.
Oh.
People are going to miss the final
We don't want to do that.
We don't want to do
Well,
that.
we could answer more questions, or we could go and see Nadia. Nadia, okay. Well, look, thanks for listening, everybody. We're open to speak to anybody who'd like to hear more about this straight afterwards, but otherwise do get in touch if you'd like to know more about the tool or the journey we went on.
Thanks very much.
Thank you.